The USAID ventilator is actually, the project title itself was, there was the USAID in donating ventilators to the 3 countries, which is Fiji, Kiribati and Nauru, and also in terms of COVID patients, the pandemic crisis that we are going through. So this was actually to help mostly the suspected or the confirmed cases with COVID in managing critical care nursing, mostly frontliners for the ICU nurses and HDU. In terms of visual training, since of this COVID, so we haven't actually gone into other regional countries, but we have managed to do some visual trainings with Kiribati, Nauru, apart from Fiji. But for the on-site one, I think we've done about 3 or 4 in relation to like mostly PPEs, one of our AGP, and focusing on our Zoll ventilator.
Taught us with some of the techniques what we should do as a nurse when you are there on the surroundings of intubation, during intubations, what we should do, like not to impose contact with the patients, and also the clamping part, especially when we remove the tube from the patient and the machine, and what we should do.
I was able to set up the Zoll. And another thing that I learned today is about intubation for COVID, because I'm sending nurses from ICU to look after COVID cases. So they are the ones that are going to manage the cases in the ICU COVID.
The main one was Zoll training and how we manage COVID patients during intubation and extubation. Since I haven't gone into COVID and I haven't nursed a patient with COVID, I have learned it was a new thing for me, learning the intubation and extubation and the Zoll ventilator.
It's, like COVID has just landed in our countries surprisingly. So this was one way nurses were really not had a clear vision, clear skills and knowledge on nursing COVID patients. But as part of the mentoring in SPC, it has really broadened, my idea in terms of mentoring. So with this, I am being a great asset back in my clinical area, and always advocating more on the appropriate nursing management on even for suspect or COVID patients.